Hi, my name is Dr. Washburn, and in this video we're going to be covering spinal injuries in the athlete. Today we're going to be using a football player as our example, but of course these principles can be applied to athletes of a wide variety of sports. In approaching a patient with a suspected spinal injury in the field, there are three key elements to remember. Number one, if a spinal injury is suspected, then the athlete should be treated as if one exists. Some things that would increase your level of suspicion would be any altered level of consciousness, any neural complaints, any pain over the spinal region, and then of course if there's any obvious deformity. Number two, an athlete should not be moved unless absolutely necessary. And some examples would include maintenance of airway and circulation, and then of course if transportation is indicated. If the athlete is to be moved, the athlete should be moved as one unit to maintain C-spine precautions. The third important element to remember is that you are the leader out on the field. You'll be the one coordinating the team members around the athlete, and the athlete will not be moved unless you indicate so. In these first two scenarios, we will play out as if the athlete is found prone on the field. In this first technique, we will be using a pull maneuver onto the spinal board. In this maneuver, you will position three of your team members on the contralateral side from the position of the head. You as the team leader will be at the head, maintaining cervical precautions throughout the whole movement. You will try to position the spinal board as close as you can to the athlete with their arm in an extended position on both sides. You as the team leader will be the only one calling out commands with the whole team. You'll position them at the shoulder and the upper trunk, the next team member at the pelvic and lower trunk area, and then the third team member will be coordinating the movement of the legs. When grabbing the athlete, you will want to make sure that you have a firm grasp of their actual body and not some loose article of clothing or even their pads. At this time, we will go ahead and demonstrate the pull technique. Rescuer number 4 will be responsible for the distal legs. Rescuer number 3 will be responsible for the lower trunk and hip area, making sure that the arm is close against the side and getting a good grasp of the ASIS. Rescuer number 2 will be responsible for the upper trunk and shoulder area, making sure to get a good grasp of the arm and the shoulder. As rescuer number 1, you will be responsible for C-spine precautions. You will hook your thumb through both ends of the pads, securing the head between both forearms securely. You will have a crossover technique in such a way because you will want to wind up on the spine board in this manner. We're going to log roll on my count. 1, 2, 3, roll. And down. I will maintain C-spine precautions as the other team members strap the athlete in onto the spine board. This is usually easiest to be done with the arms crossed across the chest. While your team is doing this, you will want to make sure that the athlete is breathing, and if they are able to speak to you, that you are making conversation throughout this process. In this demonstration, we're going to show another way of doing the log roll for the athlete in the prone position. In this technique, you will make use of 4 team members, 3 on one side of the athlete, the other team member on the other side of the athlete. With the 3 team members, they're going to be on the same side that the head is rotated. They're going to be in the same positions as the other log roll technique at the shoulders, upper trunk, the pelvic lower trunk area, and then the third team member down at the feet. The 4th team member will be with the spine board on the other side, controlling the descent down to the ground. You as the team leader will be up at the C-spine maintaining precautions and calling out the orders as you log roll the athlete. Similar to the pull technique, you will want to make sure that the arms are both in a fully extended position and that the spinal board is as close as you can get it to the athlete. On my count, 1, 2, 3, roll. Once the athlete is on the spine board, team members will then take the straps to secure the athlete to the board while you maintain C-spine precautions. In this scenario, we will be placing the athlete on a spinal board when found in the supine position. This technique is a lift technique, ideally done with about 8 team members. Today we have 6. Rescuer 1, yourself as the team captain, you're going to be at the C-spine, maintaining C-spine precautions. Rescuer number 2 will be at the foot of the athlete with the spine board. Team members 3 through 8 will ideally be lined up on both sides of the athlete, evenly dispersed along the length of the athlete. Everybody will lift on your count, and the spine board will be placed underneath the athlete once the athlete is up about 6 inches from the ground. On my count, 1, 2, 3, lift, and down. With the athlete safely onto the board, you will maintain C-spine precautions as your team secures the athlete using the straps. Once the athlete is safely strapped to the board, you will then stabilize the C-spine with a piece of tape across. Once the athlete is safely strapped to the spine board, you can then stabilize the C-spine using a couple pieces of tape across the brow of the helmet. To further stabilize the C-spine, you can also place a couple of blocks on either side of the head. Another way to spine board the supine athlete is by doing a pull-push technique, very similar to the push technique that we use for the prone athlete. With 3 team members on one side, the other team member will be on the other side with the spine board. We will lean the athlete towards the 3 team members on this side as the 4th team member places the spine board as close and as snug underneath the athlete. We will then safely lower the athlete to the ground on the spine board. Everybody ready? 1, 2, 3, roll. And down. Once the athlete is safely on the board, the team will then secure the athlete using the straps while I maintain C-spine precautions. To quickly review a couple of the key components of this video, number 1, if a spinal injury is suspected, then the athlete should be treated as if one exists. Number 2, only move the athlete unless it's absolutely necessary. Examples include maintaining airway circulation and if transportation is necessary. And lastly, always remember that you're the team captain out there on the field, that you will be directing your team, and that the athlete will not be moved unless you decide so. With a couple of the techniques that we covered, both in the prone and the supine position, for the prone position, we covered both the pull and the push techniques. For the supine position, we covered both the lift and the pull-push techniques. All these techniques are situationally dependent, and it will be up to your judgment at the time of the injury as to which will be the best for the team. Every facility has a different spine board, different straps, so always remember to familiarize yourself with the equipment. And remember that these types of injuries can occur in any type of sport, not just football. Thank you for watching this video.